What if your skin was quietly warning you about liver failure, months or even years before serious symptoms appeared? Red palms, sudden itching, mysterious dark patches. These subtle signs often go unnoticed. But today, I'll help you read them clearly before it's too late. Hello and welcome. If you're over 50, paying attention to your skin can be one of the smartest ways to protect your health. Liver disease often develops silently. By the time jaundice, swelling, or confusion appear, the condition may already be advanced. But here's the good news. Your skin can give you early warnings. In this video, I'll walk you through 5 skin changes that often appear before liver symptoms get serious. I'll explain what to look for, why these changes happen, and what steps you should take if you notice them. I've been guiding patients for years, and I've seen firsthand how early detection can make a life-changing difference. So stay with me until the end. This knowledge could quite literally save your liver. Let's start with the most overlooked early sign: persistent itching without a visible rash. I can't tell you how many people come in complaining of nighttime itching on their hands, feet, or back, only to discover the underlying cause isn't their skin, it's their liver. Here's what's happening. Your liver normally filters out bile acids and other substances. When liver function is disrupted, these substances build up in your bloodstream. They circulate to the skin and activate nerve endings that make you itch, often intensely. This type of itching usually feels worse at night, has no rash, and doesn't respond well to moisturizers or creams. Here's the important part. It can appear months or even years before any obvious liver symptoms like jaundice or swelling. Especially in conditions like primary biliary cholangitis or early-stage cirrhosis, this is often the very first sign. Did you know? Some studies estimate that up to 70% of people with chronic cholestatic liver disease experience itching before diagnosis. If you have persistent itching without a rash, don't ignore it. Ask your doctor for a liver function test, including alkaline phosphatase, gamma-GT, and bilirubin. Early blood work can catch issues before they escalate. And here's a tip. Keep a diary of when and where the itch occurs. Patterns, like worsening at night or affecting specific areas like the palms or soles, can provide important diagnostic clues. The second skin change to watch for is spider angiomas, also known as spider nevi. These are small, bright red spots with thin, radiating blood vessels. They look like tiny spiders just beneath your skin. If you press the center, the redness fades, and when you release, it fills back in. Why do they appear? In liver disease, the balance of hormones, particularly estrogen, changes. This leads to the dilation of tiny blood vessels near the surface of the skin. Over time, these spiders often appear on the upper chest, shoulders, neck, and face. Here's the important part. 1 or 2 spider angiomas can be normal, especially in younger people or during pregnancy. But multiple or new clusters, particularly in adults over 50, can indicate impaired liver function. In fact, research shows that a high number of spider angiomas often correlates with more advanced fibrosis or cirrhosis. Have you ever noticed these little red spiders and simply ignored them? You're not alone. Most people do, but spotting them early gives you a head start. If you notice new spider angiomas, especially if you have risk factors like alcohol use, fatty liver, or a family history of liver problems, schedule a checkup. A physical exam and blood tests can provide answers. The third sign is palmar erythema, also known as liver palms. Take a good look at your hands. Are the areas near your thumb and little finger unusually red, warm, and symmetrical? That's palmar erythema. Here's what's happening. Liver dysfunction leads to changes in blood vessel behavior, partly due to hormone imbalances and increased vascular reactivity. This causes the small vessels in your palms to dilate, producing that distinctive redness. Key features. The redness is usually not itchy or painful. It affects both hands evenly. Pressing on the area makes it temporarily fade. Important: palmar erythema isn't exclusive to liver disease. It can appear in pregnancy or thyroid disorders. But in someone over 50, especially with risk factors for liver disease, it's a strong clue that deserves attention. Did you know? Palmar erythema has been documented in up to 2/3 of patients with chronic liver disease. It often develops gradually, which is why many people miss it. If you notice persistent, unexplained redness in your palms, don't panic, but do get it checked. Your doctor may order liver function tests, imaging, or hormonal assessments to rule out other causes. Remember, your hands are visible every day. Use them as an early warning system. Spotting this change early can help prevent complications later. Next, let's talk about your nails. Specifically, a change called Terry's nails. This is when most of your nail bed turns a pale, almost ground glass white color, leaving just a thin pink or brownish band near the tip. Why does this happen? In liver disease, blood flow and protein production change. Reduced vascularity in the nail bed and low albumin levels lead to this characteristic appearance. Terry's nails are classically associated with cirrhosis, but they can appear earlier in the disease process as well. Here's what to look for: whitening that starts at the base and extends toward the tip. A narrow colored band near the end of the nail, affecting multiple nails, usually symmetrically. Many people dismiss nail changes as aging, but nails can reveal systemic issues, especially liver problems. Did you know? Around 80% of patients with cirrhosis exhibit nail changes like Terry's nails or leukonychia. Important note, while these changes aren't exclusive to liver disease, they can occur with heart or kidney issues too, but they're a clear sign that your body needs attention. If you notice this, bring it up during your next medical visit. It's a simple observation that can trigger timely testing and intervention.
Finally, let's talk about unexpected darkening of the skin, sometimes called bronzing. Imagine noticing a new tan or grayish-brown patches on your face, forearms, or hands, even though you haven't spent extra time in the sun. This can happen in chronic liver disease and most famously in hereditary hemochromatosis, a condition where your body stores too much iron. Over time, iron accumulates in tissues, including the skin, leading to a bronze or slate gray color. Why this matters? In hemochromatosis, skin pigmentation changes can appear years before other symptoms like fatigue or joint pain. Early detection and treatment, often just regular blood removal, can prevent cirrhosis entirely. Hyperpigmentation can also occur in cholestatic and advanced liver disease due to increased melanin production from inflammation and oxidative stress. Key signs: diffuse, even darkening of exposed areas. Occurs without significant sun exposure. May accompany other subtle liver clues. Here's the important part. If you notice this, especially with a family history of liver or iron disorders, ask your doctor about checking your ferritin and transferrin saturation levels along with liver function tests. Many people think skin darkening is just aging or just sun, but sometimes it's your liver asking for help, quietly but urgently. Your skin is more than just a covering, it's a messenger. Persistent itching, red palms, tiny spider veins. nail changes, and unexplained darkening are not random. They're often the first signs that your liver may need attention. If you're over 50, take a few minutes this week to check your skin carefully. And if you notice any of these changes, don't wait. Speak to your doctor, ask for liver function tests, and address issues early. Remember, liver disease caught early is often manageable and sometimes even reversible. If this video helped you, tap like, subscribe for more medically accurate health guidance, and share this with someone who might benefit. And if you want to learn more about the early warning signs of liver disease in your legs, watch the video on your screen right now.